Hello, good morning everyone. So my today's topic for silent killers. Every 33 seconds, someone in India dies from cardiovascular events. High blood pressure is the leading cause, and most people don't even know they have it. So, how to understand what is hypertension and why it is labeled as a silent killer? Hypertension is defined as a blood pressure consistently above 130 by 80. Consistently is a word which means regularly, daily it should be above or 130 by 80. It earns the title silent killer because it progresses without obvious symptoms. If there are no symptoms also, it progresses, quietly damaging arteries, heart, kidneys, brain over years. So the normal BP is around 120/80. Pre-hypertension is 120 to 130, 80 to 85. Hypertension is 130 by 80 or above. So what is the mechanism and how it damages your heart? How high BP damages your heart slowly. As the pressure in the blood rises, the artery thickens and stiffs. Heart plaque forms, arteries narrows, reducing blood flow. Heart strains, left ventricular enlarges, and severe outcomes, heart failure, heart attack, or stroke risk. Chronic high pressure forces the heart to pump against resistance, causing muscle fatigue, arterial damage, and eventually organ failure, all without a single warning sign in most cases. So the type of heart diseases which are linked to high BP, it can be coronary artery diseases, which is known as plaque buildup in coronary arteries, which reduces the blood flow to the heart muscle. Heart failure, the weakened heart cannot pump enough blood to meet the body demands. Left ventricular hypertrophy, thickening of the heart main pumping chamber due to chronic strain. And arrhythmias, irregular heartbeat triggered by structural changes in cardiac tissue. How we have to recognize the symptoms which are often absent or vague. So some patient may come with severe headache, blurred vision, chest pain, shortness of breath, and no symptoms at all, discovered only during normal routine checkup, damaged already done. Why symptoms are misleading? Most people with hypertension feel perfectly fine. Symptoms like headache or fatigue are often dismissed as stress. By the time chest pain or breathlessness appears, significant damage may already be done. Over 50% of hypertensive individuals are unaware of their condition until a cardiac event occurs. Risk factors. What put you at risk? First one is genetics and age. Family history and ongoing increase and aging increase susceptibility. Risk rises after 45 years. Sedentary lifestyle. No physical activity and no physical activity which indirectly promotes weight gain can cause earlier hypertension. Chronic stress, prolonged stress triggers hormones that raise blood pressure. Smoking and alcohol, high salt diet, obesity. So how to diagnose this? Regular checkups are crucial. Early detection is the most powerful tool against hypertension. Simple painless BP recording can reveal the symptoms never will. So how to do it? Home monitor. Use a validated digital monitor. Record readings twice daily before meal and before any exertion. Clinic visit. Visit a physician at least once every 6 months for formal assessments. Confirmatory test. ECG, lipid profile, kidney function test, assess overall cardiac risk. Management. So lifestyle changes. 30 minutes of daily moderate exercise, stress management and adequate sleep. Dash diet. Reduce salt, increase potassium-rich foods, whole grain and lean proteins. Medications like ACE inhibitors, beta blockers, or diuretics are prescribed. Never self-medicate. Always consult your cardiologist. Remember, medication works best when combined with lifestyle changes. Never stop prescribed medication without consulting your cardiologist. Preventing the silent threat, early intervention. So 80% of is preventable of heart diseases cases are preventable through lifestyle and early detection. Reducing systolic BP by just 10 mmHg cuts heart attack risk by 20%. So daily goal will be just 30 minutes of walking daily significantly lowers cardiovascular risk. So how you have to take away what is the normal BP? It is less than 120 by 80 or 120 by 80. Elevated is above 130/80. Stage 1 hypertension 130 to 140. Systolic diastolic 80 to 90. Stage 2 is more than 140 by 90. Consult a cardiologist if your readings are consistently elevated, your heart is counting on you. So know your BP, Check regularly, don't wait for symptoms. Act early, like lifestyle changes, weight reduction, and dash diet. Stay consistent. Medication, diet, and exercise work together, not in isolation. Thanking you. This is Dr. Sabah signing off.